All right. Hi, everyone. Good morning. Happy Thursday. Welcome to the Consortium's Paternal Mental Health webinar. We're really pleased today to have two speakers, Kevin and Richard, with us. But before we get started, I'll go ahead and introduce myself. My name is Jana Wright. I am the Consortium Coordinator. So that's the LA County Perinatal and Early Childhood Home Visitation Consortium. And I'm also joined with my partner in crime over here, Laurel Murray, who we always appreciate for organizing such events. Today's webinar is really dear to our hearts, and we're excited to spend the morning with you learning more about paternal mental health. So first, I'm going to give you a little background on Kevin and Richard and the organization that they're representing today, Love Dad. So through direct service research and training, Love Dad Support for Fathers and Families advocates for policies and practices that promote family health through the inclusion of fathers in perinatal and early childhood programs. Kevin Saidi is a co-founder and the director of Love Dad, a nonprofit organization promoting work with fathers as an expected and integrated part of perinatal and early childhood support programs. Dr. Gruenberg co-developed and researched a home visitation program for fathers and their young children meant to promote paternal engagement and family well-being. He also provides consultation and training on fatherhood, paternal, perinatal, mood and anxiety disorders, and building parent-child relationships. He serves on the Maternal Mental Health Now's Governing Council. Dr. Gruenberg provides psychotherapy to children, families, and parents in private practice. Lastly, he is the father to 2 children. And Richard Cohen, PhD, is policy director and co-founder of Love Dad and president of the California Association for Infant Mental Health and a consultant in child development. Richard has spent over 40 years at the intersections of early childhood and child welfare, grounded as a teacher at the UCLA Laboratory School. Richard was executive director of a multi-service agency focusing on young children and their families, a Head Start director, and the director of the Pacific Oaks Research Center. He led Project ABC, a federally funded early childhood mental health system of care. An LA native, Richard lives in Santa Monica and is the father of an adult child. I should also mention he is the co-lead of our wonderful father engagement work group, which you should all attend, and I'll put that information in the chat later on. And now I'll turn it over to Kevin and Richard. Thank you so much.
Thanks, Jenna. I'm going to share my screen. 1 sec. Okay. Okay, here we are. How is this? Is everyone seeing everything correctly? Okay, should be good. All right. Well, before we get started, I want to do a little exercise with you all, and I want you to think. I want you to think quickly, but I want you to think about when you think about your families, the families that you work with, or the families that you imagine in home visiting and in early childhood mental health. What do those families look like? Who's in those families? And my sense is, my hope is actually it's a family that includes more than one parent or multiple adults. But I want to sort of remind everyone of something that is often lost in our field. Okay. And that's that this could be a population of parents in Los Angeles County, parents in whatever spa in LA you work in. And about 50% of parents are fathers. I'm going to say that again because I think this point is actually lost in our field. About 50% of parents are fathers. Probably the most important statistic I'll share with you today. It's probably our most rigorous statistic also. But in our fields of perinatal mental health, of reproductive health, pediatrics, home visiting, fathers really tend to be overlooked. They're overlooked as promoters of family resilience. And they're also overlooked, and this is what we're going to talk about mainly today, about how they're also at risk of mental health and parenting challenges. So if our goal is to really develop a more robust perinatal mental health system, a more robust home visiting system, that is really promoting family health, it's really necessary we expand our understanding and approaches to integrate fathers. And that includes thinking about fathers' mental health. And lastly, and I'm going to turn it over to Richard, that none of us are well until all of us are well. And that's a message that we're going to think about in this hour, is that if we leave out a family member, leave out a family member's mental health, that a family can't function well. Okay, Richard.
Thank you, Kevin, and welcome to all of you. So glad you were able to join us today, and we're really pleased to be able to join you. It's been really a pleasure working with LABBN, Jana and Laurel, but also Martha, Charlene, Renee, and their commitment to including thinking about dads, to expanding our vision so that it's a whole family approach, has really been an inspiration to us. Kevin and I thought we were the only two people around who were thinking about this stuff, and it turns out lots of people are thinking about it, and we're grateful to LABBN and the First Five for expanding their thinking. And want to welcome you to Mental Health Month. And so that's why we have the opportunity to really be focusing on, as Kevin said, the mental health issues around dads, which we strongly believe are under-recognized, underserved, and which are critical to this expansion to a whole family health approach. And I think a big part of what's going on, happy Cinco de Mayo, by the way, which I won't even go into, but most of you know better than I that it's a strange holiday, mostly more celebrated in America than in Mexico, but we're celebrating it here. So I think that the base for the kinds of work that we're trying to do now is just the understanding of how confusing it can be right now to be a man, to be a boy, and to be a dad, a boy, a dad, and a man. Roles and expectations are changing. Issues about gender are expanding dramatically and rapidly. Opportunities are expanding, but there isn't clarity right now in society about the message. Boys are still often getting that traditional message of being tough, sticking it out, not crying. Dads are often getting the message that they're supposed to be the breadwinner, that's their major job, and if they're not doing that, they're failing. And yet they're getting these other messages about the importance of being involved, the importance of carrying their babies, of skin to skin. All dads are getting that now. And this can be a very confusing time. And then, just for no good reason, we'll layer on a pandemic, which not only has created fear, illness, and loss, but has highlighted in those 2 years not all, but many of the inequities that people of color and people of low income face. And so this is a really crazy time to try to be a dad, and it's just not clear what the rules are. And so that complicates all of the previous predilection that new parents have for depression and mood disorders. Kevin.
And yeah, I'd like to add too that, and it's not only the messages in pop culture or in culture that around being more involved as a dad, but it's also our systems give mixed messages around dads being involved. So on the one hand, we all believe that fathers should be involved, and yet we don't have a system that's ready to support fathers or that screens fathers for mental health. So it's really, so that as a system, I think in home visiting and in perinatal and early childhood mental health and pediatrics, we actually are giving the message for men to man up and to not cry, to not be vulnerable, to do what you've always done. But actually, you should be involved, and all of these things. So it's very confusing. Richard.
Mm-hmm. You want to go to the next slide? Good. So when we do our training, some of you, I see the names of people have already been in our training. We spend a reasonable amount of time at the beginning thinking about this, but we want you to take a minute. We're going to give you a minute or so after I finally finish explaining what I want you to do to think about someone in your life, your father, or a male who's had an impact in your life, and think about how he's coping with the expectations and demands of masculinity and fatherhood. And we do this, even though we only have an hour and we're going to be talking really fast part of the time, to ground all of us in that personal experience. It's a sort of 1 minute of reflective practice, because we are the agents of change. So read the slide, take a minute, and we'll be back.
What do you think about a father in your life and how he is coping with the expectations and demands of masculinity and fatherhood?
Okay, thank you. And I hope that you were able to think about the cultural impact of this. It's a very evocative, we hope, evocative way to start this conversation, because what we're experiencing, as I said, is going to affect the way we approach our direct work with families, the systems that we create for families, the way we supervise people who are working with families. So that's our base. And now I'll turn it back over to Kevin.
So we know that dads are at risk of mental health challenges and of struggling through becoming a new father in ways similar to moms. And I want to highlight some of these risk factors to shape a little bit about what the fathers we might be working with are experiencing, what their threshold might be for managing their stress. And oftentimes we see just men experiencing just too much and not being able to bear the weight of all of the experiences that they've had in their lives. And I want to start with the sort of social or structural factors that really influence really wellness, actually. We think about that these are all risk factors for mental health, but they're really challenges to feel well and feel good about yourself, to feel engaged with your family. And so structural racism is a huge challenge, and all that entails around access, around incarceration, around housing, employment, and everything that sort of that entails. When we think about economic and resource instability, it's really hard to be well if you feel like you don't have enough, or you don't have, and you're constantly working to just make it. And I think for many men that can be actually quite humiliating and shameful, given the message that men are often given, that they have to be providers, that they have to be the strong ones. So to be unemployed or underemployed is both structurally hard for a family because you just don't have enough, and it's psychologically hard, humiliating, shameful for us. We know that education levels actually are also risk factors. So fathers that have higher levels of education seem to fare better in terms of mental health as they transition to fatherhood. But we know that education levels and access are really linked. When we think about the pressures around hypermasculinity and heteronormativity for fathers who don't identify in that way, or for men who don't identify in that way, that can be quite oppressive. Looking at some experiences of the past, trauma is a big risk factor when it comes to fathers struggling during the first year of a child's life. Previous mental health challenges. Also, when we think about all that a child might experience and how they might come into themselves as adults, ACEs are really important to think about. Although Richard's often reminding me and us, if you've ever been in his trainings, that that ACEs can be problematic as a questionnaire to meet someone for the first time and ask them about what are the 7 worst things that have happened to you in your life. But we also need to think about having all of those adverse childhood experiences do shape your experiences as an adult. Substance abuse challenges in the past also are big risk factors for fathers. Just because the transition to fatherhood is probably one of the most challenging transitions that a man will go through in their life. From just the amount of responsibility, the amount that's on your shoulders when you are then responsible for taking care of a child or a family. And you tend to rely on what might be automatic or what might help you cope. And a lot of men don't have good coping strategies. They weren't raised to learn about how to talk about their feelings, how to seek out social support, how to utilize what's available to them emotionally. So when fathers are also transitioned to be fathers, there are big changes sort of in the relationships in their life as well. So if they're in a relationship with the child's mother, there are going to be big changes around what's available for them, how they might have time together. There tends to be a lot more couples conflict during the first year of a child's life, just because of the load that both parents are experiencing. Maternal depression is a big risk factor for fathers. In fact, I think the risk of paternal depression increases by over 3 times when a mother is depressed. And also men tend to have limited social support. They tend to endorse more loneliness. They tend to be less connected to people. So when they become parents and they're experiencing the sort of load of being a parent and all that sort of entails, they tend to have less people to go to for support. Some of the biological changes are really interesting. I'm going to speak about them. I do think that the social, environmental factors that I just mentioned all have the most influence on how a man transitions to fatherhood and some of their risk factors. But the biological piece also has an influence. And we can start with just probably the most simple one, is that, and one that's least contestable, I should say, is that a lack of sleep does not support anyone's well-being and mental health. And when you have a new child, your sleep is really disrupted. And that is a risk factor. And then no one does well when they're woken up several times in night, or they're up for 30 minutes 3 times during the night. Men also go through hormonal changes, actually similar to hormonal changes that women go through. And in our day-long training, we spend more time talking about some of these changes, but these hormonal changes are supportive of fathers nurturing and connecting with the baby. So there tends to be a reduction in testosterone in men who are in relationship to their pregnant partner. And these testosterone rates tend to lower almost about a third of what it was prior to being pregnant. So that promotes bonding, that makes men less aggressive, that helps men think about their child's feelings, helps them understand what's going on for them. And what it also does actually is it primes a father for depression. So what we found is that dads who don't have testosterone rates lessen over the course of expectancy and early fatherhood, they're much more likely to struggle with mental health challenges, but also they're less likely to be bonded with their child. So actually something about the vulnerability about bonding with your child, about being in that space where you're really responsible for a child and all the ways that means, that predisposes fathers to struggle. And then there's some other risk factors, and that could be around birth challenges. If a child is in a NICU, I mean, what could be more stressful than having a baby and having a child in a NICU? I mean, it's stressful, terrifying, nothing like you would have ever imagined. Having a child with developmental challenges can also be quite overwhelming, and at times make it harder even to connect with your child. So the WHO, I've adapted this definition from the WHO about what this was a definition of maternal mental health. I adapted it for paternal mental health, but it reads paternal mental health is as a state of well-being in which a father realizes his own abilities, can cope with normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his community. And then Richard and I added, and joy. So being able to experience joy in being a father. When you think about all of these risk factors that I just mentioned, all of these experiences fathers might come into parenting with, you can see how actually this can be quite a challenge to experience some of this well-being. This is one of the reasons why we cannot ignore what a father both has experienced in their life and also what they've experienced in their life and what they're experiencing presently. Okay, this slide is well, Charlene, I know you're here, and I'm embarrassed to read off my statistics with such a statistician in the room, but I'll do it anyways. And Charlene, you can just turn the volume down. But I'm into simple statistics. You know, I don't want to make anything too complicated. So there are about 10.4 million people in Los Angeles County right now. And of those 10.4 million, about 5.2 million are boys and men. About 75 to 80% of people become parents in their life. So that's about 4.16 million boys and men will become fathers in their life. Currently, boys and men in Los Angeles. So you're either going to become a father or you are a father. Okay. So about 10% of new fathers, and this is not my statistic, this is real statistics here. 10% of new fathers actually experience a perinatal mood and anxiety disorder. And I remember hearing that number for the first time, and I needed to make that a little bit more real for me, because 10%, while it seems like a big number, actually I wanted to make it more tangible. I'm not a numbers person. And so I started to try to figure out, well, what does that mean for boys and men living in Los Angeles County right now? And that means that about 416,000 boys and men will experience, have experienced, are experiencing or have experienced the perinatal mood and anxiety disorder in their life. That's a lot of people and a lot of boys and men in Los Angeles County that have or are predisposed to experience this. That is a huge number. And it's a huge number, and also it's like amazing to think that no one really knows that actually. Even most people in our field don't even know that dads are susceptible to these challenges. What we know is that, and I mentioned this earlier, that dads who have partners who are experiencing maternal mental health challenges are actually 25 to 50% of these fathers are experiencing perinatal mood and anxiety disorders. So when we think like, okay, we're doing a great job, we're treating a mom for maternal depression, we're not doing that enough. Okay, just we know that, but we're doing a good job. We're supporting the child in managing the maternal mental health challenges, supporting the mom. But we know that by ignoring the dad, we're keeping the family vulnerable. Because we could probably bet on actually that if a mother is experiencing a perinatal mood and anxiety disorder, a father is. It's actually probably a safe bet at 50%. We know that anxiety rates are a little bit higher than depression rates in new fathers. So that's about 20% of fathers are experiencing clinical anxiety during the first year of their child's life. And also that when we look at the first 5 years of a child's life, dads are much more susceptible during that 5-year period to experience mental health challenges than any other period in his life. These studies have been done internationally. They've been done in communities throughout the US. And actually, Richard and I and Los Angeles Best Babies Network are working to create a depression screening pilot so we can get more of a sense of this within our home visiting community in Los Angeles. See if I want to add anything else. Oh yeah, I'll also add that dads tend to experience these challenges between 3 and 6 months postpartum, which is a little later than mothers tend to experience postpartum. So if you're doing visits right now and you're in Welcome Baby and you're in your 6-month visit, this would be a good time to start really thinking about a father's mental health. So now I'm going to show you a short video about men talking about some of these issues.
There's this kid that you don't really want right now. It sucks.
I felt completely alone. This house became like a prison.
We've always been raised as being the tough ones who don't share or don't have emotion. To me, it takes a bigger man to realize that I don't like where I'm at with this, so I'm going to go get some help. It happens more often than what we think. The overwhelmingness, the sense of not having control over your life anymore. Most of the men just suffer in it and try to get through it the best way they can.
Men are supposed to power through, but that's not fair.
It's hard to reach out to your family and friends, feel inferior and feel like you're not good enough. I felt a bit lost about who I was.
A sense of despair. I was convinced that I was going to be kind of trapped in that space with no end in sight.
Part of it is a deep feeling of regret.
The way that I felt came on like gradually and got worse and worse and worse.
enough support or access to support for men when they're going through things like this.
This doesn't make you a bad dad. It doesn't make you a bad person. It doesn't make you less of a man.
You know, even watching this, I was actually reminded of something I haven't thought of for a long time. A message that I got when I was first trying to start these father groups for new fathers around mental health. And I was really just getting started, and I didn't know LABBN at that time. And I thought it would be simple just to start a group. And I got one call to get this group going in months of trying to advertise, which was really sad. And it was from a mother who was so offended that I would even think about a father's mental health, because like what was said in this video, he didn't carry, he's not dealing with anything. How dare you start this program for fathers? And I remember I was really taken aback by this, but this is a message actually that that is pretty commonplace actually within our communities. Okay, I've talked a lot. Richard, your turn.
So you would say that the mental issues of men fathers tend to, I'm looking at Elizabeth's comment, harmful or yes. So exactly. Thank you, Elizabeth, because you transitioned us right into what we want to talk about next, which is about how, so firstly about how depression expresses itself in men with newborns, and then secondly what that means to us and how we interpret that behavior. And a big point of the second half of this hour is really to help us all try to reframe the way we're thinking about this behavior. So if you think about what the kinds of things that are the kind of behaviors that result from depression, we have men who are very irritable. They can't stand, they're overwhelmed, and so any kind of pressure on them to participate, to do something, to say something, to be responsive, to go to the store is more than they can tolerate. And they're often socially isolated and withdrawn. And there is an increase in the abuse of all kinds of substances and an apparent disinterest in the baby. If it's just more than he can tolerate, right, then he pulls back, becomes isolated, and pulls away from the baby and all of the things that that baby represents to him, including just being overwhelmed. And there is an increase in anxiety. And when we think about all of these experiences, plus adding to that the kind of meta level responsiveness to I cannot be experiencing this, I'm tough, I can get through it, if I'm experiencing this, I must not be a real man. All of these things together can make this dad very difficult to be around. And go to the next slide, please, Kevin. And when we think about, if you think about home visitors going into the home and they find a dad that's irritable, they find a dad that's doesn't want to have anything to do with it, or the dad simply is unavailable, or is difficult in any way, these are things that push us away from the dad, and they can make us be scared of the dad, and they can make us discount the dad, like, what an asshole, just one more asshole dad. Now, there are dads who are assholes. There are all kinds of people who are assholes, but our initial reaction to, it's just another one of those dads, he's just a jerk. When we have that feeling, what we're trying to help all of us do, Kevin and myself included, is to try to reframe those behaviors and wonder, is there something else going on here? These are the, by the way, these are the signs of anxiety and depression. I wonder if there's something more going on here, and if these behaviors, which are hard for me to tolerate or scary for me to tolerate, are actually signs that this dad needs help, rather than that this dad needs, I need to keep him away from the mother and the baby, and definitely away from me. And that's the reframe that we're looking for. That in reflective practice, we talk a lot about this, recognizing the somatic aspects of what we're experiencing. So when we have that feeling, I'm pointing here, you can see me, but that's because that's when I feel these things, this is exactly where I feel them. You may want to think about a dad that you see as this, that typical jerk, and feel where you feel it, and recognize that when you feel those feelings, they are real, but they might be indicators that something else is going on with this dad, and that we have both an opportunity and a responsibility to be sure, and to be sure that he is getting the support that he needs. And that responsibility is to him, and it's to the mother, and it's to the baby, it's to the entire family. Because, as this slide tells us, perinatal mood disorders and mood affect the entire family. One of the first things that first realizations that Kevin and I came to when we started our own home visiting program with dads, our initial referrals came from the UCLA partial hospitalization program for moms who were experiencing serious depression. And one of the first things we realized was the depression was not just affecting the mom. Even if the mom was in the program, not physically present, the depression was always part of what was going on. And paternal depression is the same thing. It puts stress on the entire family, so that it is, as Kevin has said, correlated with maternal depression. There is this lack of engagement with the child, where in a situation where the child benefits tremendously from being able to have a father figure, father interactions, to have a range of interactions with different people who use different styles. It is related to increases in child abuse. It is unfortunately also related to intimate partner violence. And importantly, because our programs are looking at those babies, but every one of those babies is going to become an ex-baby, right? And grow up. And we know that that paternal depression is related to increased child psychopathology when the child is, by the time the child is 5 or 6. So when we miss these, when we push dads away because they're unpleasant or difficult, we are missing the possibility of supporting the entire family, of bringing joy and health, mental health and wellness to the entire family. And that's the key message for today, is that understanding these are possibly, not always, but possibly symptoms of depression, these difficult behaviors that we see in dads that we react to so badly, reframing those in a way that helps us wonder what they are a symptom of, and supporting the entire family. Kevin, I see you leaning in like you're going to add some stuff, so please go ahead.
Well, I was thinking about whether or not I wanted to.
Yeah, you do.
No, I do. Because I want to both, I want to also sort of think about how when a father is depressed or struggling at this time, actually the practical ways that a father might be able to support a mother and support a family become more strained or they're less able to do that. And that could even be around keeping down a job, because it's very hard to work when you're depressed. And if you don't have a job, your housing is then at risk. And if you have a baby and your housing is at risk, like think about what that will do to the sort of fabric of a family. And so when these things get ignored, the strain on family life just is exponentially more difficult. And so again, I know I've said this, but we cannot ignore as a field the impact of, we can't think we're really doing a great job to promote family resilience. Let me say this, if we ignore dad's mental health, because it's particularly when we're dealing with moms who are struggling with mental health challenges.
And Laura has
Oh yeah,
an important question and concern, and we're gonna switch into, so what are our roles as home visitors and as supervisors of home visitors? But the first thing I want to say for those of us, I think Kevin is probably the only actual therapist in this meeting. There may be some others of you whom I don't know. But Laura's question is, how can we distinguish a jerk from a father who needs help? And the fact is, those of us who are not trained therapists and don't do assessments, we can't, right? So what we need is to be part of a team that does that. We are moving towards a world in which we will add depression screening for dads to our home visiting programs, but we are not there yet. But what you can do is to bring back that reaction to your supervisor, to be aware of the support systems that are available, limited though they are right now, for dads with mental health issues. And I know in the child welfare system, one of the things that we talk about, and this is what I'm going to say now, is asking a lot, particularly reading the second half of Laura's question, which is about the models that exist right now and how to integrate this work into the models that exist. In the child welfare system, when we're talking about kin care and foster care, we talk about shifting from a model of time out when children are difficult to time in, that what the kids actually need is more connection. And so if we're wondering about, is this a jerk or is this a depressed dad, could be both, the first thing is not to do the instinctive thing, which is to just push him away or to be perfectly happy that he's having nothing to do with this, but to wonder about how to find out more and what resources are available.
I'm going to add something too, because I think Richard, actually, we usually agree. Every once in a while, we don't totally agree. But I think this is a situation where I don't totally agree with what Richard is saying. I think we can assume that if a father is a jerk in the programs that we're dealing with, that they're struggling. That because we know that when men tend to, when they are vulnerable, they tend to turn vulnerability, or they feel ashamed, they turn vulnerability into grandiosity, into sort of externalizing behaviors that are sort of offensive or that are not really thinking about other people. So we know that that is actually a symptom of how men struggle, and how what men do with vulnerability, shame, pain, sadness, loss, the list of all those types of feelings. So I think that is a time, and I do agree when Richard's saying, like, yeah, get support, talk about it in your supervision, to really think through, okay, well, what is going on here? And
Yeah.
it's not only therapists that are able to think about to reframe what we see in our families and and the parents that we work with, to reframe it as a way of at seeing them for what they're struggling with.
So actually, let me say that I disagree with Kevin on whether we agree, because nothing that I said, all I meant to say was, in the same way that those of you who have been in my developmental delay in the ASQ screening course, it's not our role as home visitors to diagnose anything, right? But to assume that there is something going on here that may be a mental health issue that could use some support. And I think Kevin's right, although I hate to admit it, that the default should be there could be a mental health issue. But in the same way that if a mom says to you, so does he have autism? You know, we have to find polite ways to support the parent without answering the question, but to bring in someone who's an expert in this. Those of us who are not therapists are not in a position to make a diagnosis or to pathologize the father's behavior, which can have other kinds of problems, but to wonder what's going on and assume that the father could benefit from someone like Kevin. Okay, maybe not someone like Kevin, but someone having a look to see if there's some support that they could provide.
Well, move on.
All right. So, well, it's good that we've already had some of the conversation. Really briefly, because this is such a short hour, really briefly, what I've already talked about a little bit is this move towards screening for paternal mental health and depression. You are already aware that the programs through LABBN and the consortium are using the PHQ-9. There is also a depression screen that is specifically for dads, but it looks like the direction that we're going is that we're going to be moving towards using the same system for screening everyone. And I think, you know, reinforcing Kevin's mantra that none of us is well until all of us are well. It's a really important part of this. And when this is happening with dads, when they're experiencing it, you know, all of these things happen that affect all of the members of the family, as we discussed in the previous slide. So it really is a family issue. And for those of you who have gone into this work because the next generation of babies is important to you, the growth of your communities is what you're committed to, then we all have this responsibility to support the dads, regardless of our experience with dads, in order to support the whole family and help the child thrive.
And when you all start screening fathers, because I assure you that at some point in all of our careers, we will be screening fathers regularly. There are times when dads that you can clearly see a dad is struggling and their PHQ-9 score is quite low. And so we need to be able to use common sense and sort of assume that we might get lower scores, and to be able to ask fathers and use our think through the moment, I guess.
And to the extent that the more contact that we're able to have with dads, the more we can listen to those little, you know, when you ask a dad how he's doing, to listen to those answers. And if he's feeling out on a ledge, or he's feeling exhausted, or he's how to hear those as, to come to feel those as cues that something's going on, which we can start doing now even before we integrate the screening tool into our work. One more comment from Elizabeth. Into our visits, or at least giving them a safe space, feel like they're valuable in the pregnancy as well as when the baby is born. Yes, Elizabeth, you have been channeling our hero Anna Machen, from Great Britain, who talks about that first thing as we shift into what can home visitors do, which is acknowledging fathers as significant in the family and listening to them, seeing how they're doing from the very beginning. Those of you who are working in hospitals have this opportunity to help dads find a role, recognize a role, determine how they want to participate, and understand how they're doing just by listening. As Yogi Berra tells us, you can observe a lot just by watching. And if we begin, this is my favorite line in all of this work, let's begin with the assumption that dads are in, that dads want to be a part. That will change the way we approach things. And if we're lucky, it'll become a self-fulfilling prophecy, that if we just accept dads as a normal part of everything that we're doing, dads will feel that they're a normal part of starting a family with a new baby. And if we include in that listening to dad, asking about how he's doing, that, as the slide says, that really promotes well-being.
We do need screeners, but you don't need a screener to ask a father how
he's doing. Absolutely, that's a very succinct way to put it. How can we try?
I want to add one more thing to this section.
Yes.
Is that I just was reading this Rebecca Solnit article in the New York Times, which I recommend. I'm happy to circulate it if after this. But the article is about kind of this, how we, in the United States, we've lost the ability to believe in people's capacity for change. And I think particularly we don't have much of a belief when working with men in their capacity to transform, to change. And as home visitors or people working with families, we need to hold that very dear to us, that belief in the capacity, with our help, with our support, with the right connections, that we can help people transform and change their lives. And without that, it's really hard to do the work that we're doing. So
I want to respond to Estela's really important question about the fact that the vast majority, which is an understatement, of people working with children 0 to 5 are women. How can we try to not let this be a barrier for fathers to access information? And I think that this is the key. This question is the key question, and explains why we start with helping you understand your own approach to being in the company of men. And many of you have not had wonderful experiences with men, and that's the real truth. And many of you find the machismo of presentation of men to be off-putting,
threatening,
and
even threatening,
threatening. Yes. And I think our whole point in this morning of helping you, even if not reframe the way you think about, I mean, an hour is not going to be the answer to changing your view about men. But our goal is not so much to have you change your view about men as to recognize your view about men and look at this dad and wonder, to recognize that from the context of your life and cultural experience, that could be a barrier to my seeing what this dad needs. And this is not, even though I'm pointing my finger at you, this is not to point fingers. This is to understand that this is a process, a transition. And I also think that, that part of what we want you to be able to do is to recognize how structurally things are organized to ignore dads, not even necessarily to leave them out intentionally, but just not to think about them. I ask her to give a dad a book. I usually bring him with me and have to, so read to the baby. Yeah, there we go. I'm trying to see, is this still, yes, this is Elizabeth. Thank you. Yeah. So these are some Elizabeth has some simple things that you can do with dads that will help dads connect, but also my guess is, I can't speak for Elizabeth, but it's also helping Elizabeth connect with the dad. And it's only through that connection that we're going to be able to wonder about what's going on with him and have him more open to the support that you can provide.
I want to add something too, because I think we are talking about mental health and that we can use, actually, we often, most of our training on fathers has been around father engagement and trying to keep fathers engaged with kids, keep fathers engaged in the program. We can also engage fathers around their mental health and around helping educate them on signs of distress or some of the challenges, like Richard mentioned, around irritability, around alcohol or substance abuse, around withdrawal, around feeling somatic or physical symptoms, that we can help sort of create a language for the father around, like, hey, this is what it looks like when you're having a hard time and need help. That trying to convert the "I just don't feel right" sort of comment or feeling to something that, yeah, I can get help for this. And also we can educate fathers around improving their well-being. So we don't have to be therapists to recommend, like, sleeping is really important, having a good sleep schedule, trying to balance that with your partner if you have one, eating well, exercising if possible, exercising with your child, if it's about taking a walk in the neighborhood or something like that. Oh, I think Richard actually popped off. I think he had to, oh yeah, he had to pop off. So I'll finish this. We also need to screen for paternal mental health challenges. Now, I know that hasn't started yet, but we need to do this. This is an absolute necessary piece around if we're thinking about supporting men's mental health on a public health level. It's just, it's baseline. Like we do for moms, and and that's actually a law now that we do that for moms, or that's it. Okay. I think we need to talk to dads about identifying their social support. Again, you don't have to be therapists to be able to ask a father, hey, who can you go to talk to about some of the things you're dealing with? Do you have any friends who are fathers who might understand what you're going through? Are there family members that you might talk to, or are there people that can help you out for the day so that you can go visit with a friend, or go for a jog, or whatever you do, go fishing. I mean, whatever it is that you do to promote your mental health. We need to, I know we're at time, but I'll go quickly. As Richard said, this is where we talk fast. Be ready to refer fathers to mental health support. And that's what we're really trying to work on in LA County, is trying to build that referral network and that support system. And it's not enough right now. Keep coming to these trainings, engage in reflective practice. Richard and I, we run a father engagement consultation group the third Tuesday of every month. It's posted the link is posted every week in the LABBN Consortium newsletter. And it's free. It's a reflective based group. We talk about our work with fathers, and we all think together about how to improve the work that you're doing and be thoughtful about it. And we are talking a lot about like some of the barriers or what it's like to be I don't know what it's like to be a woman doing home visiting and trying to work with fathers, but we've been talking about that. And some of the women who have come to the group talk about what a barrier that is. And we're working together to confront some of that. And then lastly, this is really a new area in the field. There really are hardly any experts. Ralph is probably the only expert in this whole room, okay, about working with fathers. He's worked with more fathers than any of us. And so there are hardly any of us out there. So we expect everyone to be uncomfortable with it. Everyone needs support. We need to be able to talk about it. I don't know. I know I'm out of time. It's been a real pleasure doing this. And Jana and Laurel, I'm so grateful that you had us talk about something that I feel so passionate about and feel like this is low-hanging fruit. If we can do this, it'll just make an incredible difference for the fathers in our communities.
Thank you so much, Kevin and Richard. We know you're off, but thank you to you too. Amazing webinar. I have pages of notes of things that I learned and I appreciate it. I'm sure everyone feels the same way. We will be posting this recording to the consortium website. I put the link to that to the website in the chat box earlier. I also put a link to the Paternal PMADS or perinatal mood and anxiety disorders infographic that Kevin's daughter actually put together, and it's amazing. So definitely look at that, send it out. And it's just it's a good way to digest sometimes difficult to understand information. We appreciate you all very much. I hope you have a good rest of your Thursday and a happy rest of your week. Happy Mental Health Awareness Month, everyone. Stay safe. Take care of yourself. We'll see you later.
Thank you. Thank you all.